Hello, I am Stephen Collins, the CEO of Matter. Thank you for joining us for our second oral health innovation event, engaging people in their oral health. Matter is a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change of healthcare. Since we launched in 2015, we've supported more than 1,000 startups from all over the world, and we have a suite of services to help them at every stage of development. We run 6 to 8 startup accelerators every year in partnership with large health systems, life sciences companies, payers, associations, foundations, each one focused on 5 to 10 companies innovating in a particular area of healthcare. We work with dozens of health systems, payers, life sciences companies, helping them collaborate with the right entrepreneurs and innovate more effectively. We are the digital health hub of BARDA's accelerator network. BARDA is an arm of the Federal Department of Health and Human Services that is responsible for innovations to improve the country's resilience in the event of public health threats. And we host events focused on healthcare innovation, bringing people together to be inspired and learn and connect with each other. This is our 4th year working with CareQuest Innovation Partners on Smile Health, an accelerator program where transformational solutions to improve oral health take center stage. We are empowering innovation that helps the world smile through propelling the integration between oral health and overall health. For the past 3 years, we've invited entrepreneurs worldwide to share solutions that make oral health more accessible, more equitable, and integrated into overall health. We've received close to 300 submissions from around the globe and have 16 alumni companies of the Smile Health program. These companies received mentorship, curriculum, and most importantly, validation studies with industry leaders and investors such as Colgate-Palmolive, Sun Life Dental, including DentaQuest, and Dental Innovation Alliance, who are here with us today. We launched the 2025 Smile Health program in March with 3 main focus areas: advancing accessible, equitable, and integrated health, engaging people in their oral health, and connecting chronic care with oral health. Today, we are joined by industry-leading experts who will step through the focus on engaging people in their oral health. We're joined by Brett Bostrak, the Chief Network Officer of Sun Life Dental, including DentaQuest, Dr. Marian Ryan, the Chief Clinical Officer for Colgate-Palmolive Company, and Thomas Sharp, co-founder and managing partner of the Dental Innovation Alliance. After we hear comments from today's panelists, we'll share more details about the Smile Health 2025 program, including how you can apply or get involved. And now I would like to introduce our moderator for the day, Denise Marks. Denise is the Chief Financial Officer and Executive Vice President at CareQuest Institute for Oral Health, bringing more than 25 years of experience in finance and operations, ensuring the organization's financial health and strategic success. With a background in healthcare investment, compliance, and leadership at firms such as SV Health Investors and PricewaterhouseCoopers, she plays a key role in advancing innovation and access in oral health. It is always a pleasure to work with you, Denise, and your entire team at CareQuest. It is a partnership we very much value, and we are looking forward to this conversation today. And with that, I will turn it to you to take it away.
Hey, thank you so much, Stephen. It's such a pleasure to partner with you and your colleagues at Matter for Smile 2025. I'm really excited to lead this discussion with our panelists today on how we can better engage people in their oral health and help to reduce oral health disparities. I do want to touch briefly on who CareQuest Innovation Partners is and what we do. We are the for-profit affiliate of CareQuest Institute for Oral Health, the world's largest nonprofit focused on oral health. Our mission is to validate and scale transformative solutions to improve overall health through oral health for all by ensuring that oral health is accessible, equitable, and integrated with overall health. And in my capacity as CFO at CareQuest Institute for Oral Health, I have the great pleasure and honor of leading CareQuest Innovation Partners and the work we do. The work we do is really focused on three areas. Smile Health, our accelerator program, which Stephen just touched on, and you'll learn more about after our panel discussion today. Impact Investing, where we currently have a portfolio of 5 companies, soon to be 6, which we have invested in, typically early stage companies, focused on innovative products and solutions aligned with the mission of CareQuest. As well as innovation solutions and services, where we partner with other companies to help pilot, validate, and scale innovative solutions through providing advisory services. I'll start with Smile Health. Smile Health is a unique and proven accelerator program. We are in our 4th year, as Stephen mentioned, of doing this, and we focus on advancing solutions that improve accessibility, equity, and the integration between oral and medical care, and improve awareness and engagement in oral health. Our mission is to ensure that everyone, regardless of their background or circumstances, has the opportunity to achieve better oral and overall health. We know that increasing awareness, access, and proactive engagement in oral health can drive meaningful improvements in health outcomes overall, particularly in underserved and marginalized populations. Each year, the Smile Health Accelerator Program supports entrepreneurs and startup companies that are developing innovative, scalable solutions to help tackle the barriers that exist in individuals achieving oral health today. From AI-powered tools that improve patient engagement or early detection to groundbreaking technologies that expand the access to care, these solutions are just a few examples that are shaping the future of how oral health is delivered today. Through industry collaboration, validation studies, and deep partnerships, we are helping to accelerate the change in this space. I want to thank all of our industry partners for their support in making this work possible, especially Sun Life Dental, including DentaQuest, Colgate-Palmolive, and Dental Innovation Alliance, who are with us here today and will join us on this panel. We know that oral health is often treated separate from overall health, but the reality is it plays a fundamental role in an individual's ability to achieve optimal health and long-term wellness. Lack of access, education, and preventative care can lead to serious health disparities, disproportionately impacting historically underserved communities. Today's conversation will focus on how we can drive greater engagement in oral health, empower individuals, providers, and communities to take a more proactive role in their oral health care. So today, I would like to introduce our speakers and panelists and have them turn on their camera as I announce them. First, we have Brett Bostrak, Chief Network Officer, Sun Life Dental, including DentaQuest. Dr. Maria Ryan, Chief Clinical Officer, Colgate-Palmolive, and Tom Sharp, co-founder and managing partner of Dental Innovation Alliance, or DIA. And so now I would ask each of them to briefly introduce yourselves, starting with Brett.
Thank you, Denise. Good afternoon or good morning, depending on where you are. I'm Brett Bostrak, Chief Network Officer for Sun Life Dental, including DentaQuest. I have been with DentaQuest for over 25 years, so I'm very excited to be part of this panel today and talk about this important topic. DentaQuest and Sun Life Dental, we serve about 35 million people across the country. We have a footprint within all the segments, commercial and employee-sponsored, Medicare, and Medicaid. And the latter, of the 35 million members we serve, we have about 26 million in the Medicaid space. So I'm excited to talk about this topic today and how we engage people in oral health. recognizing that members across those different segments have some common barriers and probably some that we'll find, especially those in Medicaid programs, have some distinct barriers of their own. So it's a privilege to be here today. I'm looking forward to it. Thanks, Denise.
Great. Thanks, Brett. Dr. Maria Ryan, you take a moment to introduce yourself.
Thanks, Denise. Maria Ryan, Executive Vice President and Chief Clinical Officer at the Colgate-Palmolive Company, previous academic and practicing periodontist. And I'm, really excited to be here, as our purpose at Colgate-Palmolive is reimagining a healthier future for all people, their pets, and our planet. And so my role at Colgate is oversight of all of our clinical operations, not only for oral care, but in skin health globally, and also our clinical innovations team developing new ways of evaluating technologies. And we've worked with DentaQuest and the team, as there are certain companies that have come forward to try and help them to evaluate their technologies. And I also have oversight of our knowledge management team, which really helps to develop all of our claims and to support them, and our scientific communications team, because as you develop the science, you have to communicate it to consumers, to practitioners, to policymakers, to many people throughout the world. So, all of these elements come into play as you're developing technology. So we're happy to be here and to help out in any way we can.
Thanks, Maria. Tom?
Yes, Tom Sharp. I'm very pleased to be here. It's an honor to speak with you all, and thanks for having us. So I'm the co-founder and managing partner of DIA, aka Dental Innovation Alliance. My background is law and business. I got training in that, and then I jumped into DSO operations right after law school. And so did that for about 21 years. At the conclusion of that, I was rolling out of DSO space, and Doug Brown, who I co-founded DIA with, and I were inundated with a lot of different dental innovation. People were coming to us, they were saying, look, I have this solution for this pain point in a DSO or a dental office. What do you think? And so Doug and I started to invest in a handful of those. That was the kind of the precursor to DIA. But we thought this would be so much better to do with a larger group, a more robust due diligence apparatus, support, et cetera. And so that's how DIA came to be, with an official start date of October 10th of 2022. And I would say that, now we're moving into, we've come through a couple of eras in DIA, but we're moving into a fund era. We have a $70 million fund we're raising on the cover of it. And our colossal advantage at DIA is the fact that we have an investor core, which is very influential and can open up sales doors for the innovators we invest in. So there's a lot of market access and mentorship behind what we do. And just one last point on this, we've seen about 1,300 companies come across our desks at DIA in terms of potential investments. And so this is not slowed down at all. It's increasing. Very, very enthusiastic and excited about the innovation that's happening inside of the industry.
Great, thanks, Tom. Well, as everyone can tell, we have an amazing panel here today, bringing a variety of perspectives to the discussion, and I am really excited to dive in. But before we do that, I am going to share a few statistics to level set a little bit of our discussion and kind of pave the way for the conversation to come. So a couple of stats. According to a 2024 report by the American Dental Association, only 43% of adults visit the dentist on an annual basis, with cost and lack of awareness cited as the key major barriers. More than 19 million people visit their dentist annually, but do not visit their primary care physician or other medical professional in a given year. That's according to a DentaQuest Institute study. More than 68 million adults in the US lack dental insurance, making oral health care inaccessible or cost prohibitive for many. More than 56 Americans live in areas with a shortage of dental professionals, thus creating challenges for access to care. According to another study, emergency room visits for preventable dental conditions cost the healthcare system almost 2 billion, that's billion with a B, annually here in the US alone. So hopefully that gives you, you know, a framing for the conversation and why we believe it's really important to engage patients and consumers in their oral health. So Brett, why don't we start with you? What do you think are the biggest barriers you see in preventing your members or enrollees from engaging in their oral health?
Well, great stats. First of all, thanks for sharing those at the top to provide that context. And it's a great question. I think I can probably start us off with 4 barriers or categories of barriers. I'll list them first and then talk briefly about them. So in no particular order, though, it would be a low benefit awareness. Number 2 would be a lack of motivation or perceived value. Number 3 would be ineffective member communications. And the 4th would be limited access to providers of care. So let me touch on those briefly, and my fellow panelists, please feel free to jump in there. Low benefit awareness, you mentioned it in terms of the 43% of adults only going to see a dentist, then they mention awareness or cost. We know that many members, don't even realize they have dental benefits, and if they do, they're not really sure what's covered. I think we know many don't really understand even the first step in engaging in their care, like how do I find a dentist that takes my insurance? There's also misconceptions driving some unnecessary friction, such as do I need a referral to go to the dentist? Or many members don't realize how inexpensive or even free it is to access preventive dental care. So low benefit awareness is number 1. I did bucket under the second one really 2 things. It's a lack of motivation and a lack of perceived value. And what I mean by that is, unfortunately, we know that dental is often considered to be elective, especially if a patient isn't in pain, right? It's considered elective. Oftentimes, dental anxiety, fear of pain, maybe a bad dental experience in the past breeds additional avoidance. A lot of people are balancing their job and how do I find childcare and how do I find transportation? And when they have to balance all those things, prioritizing dental, especially if it's preventive, elective dental, right, might just not rise to the level of getting their attention. And then I think most importantly, just too many are insufficiently educated on the importance of oral health as it relates to overall health. For those of you who were on the webinar last week on chronic conditions with Matter and CareQuest, Dr. Hungate mentioned that dental, and we've heard this before, dental is the tip of the spear, right? It's such a great opportunity for somebody to engage in their health by starting with oral health. Quickly, the third bucket was ineffective member communications, and it's worth noting that if we improve member communication, we probably can address the first 2 barriers I mentioned, improve awareness, right? Get over some of the misconceptions. Traditional outreach methods, generic mailings and robocalls, they go unnoticed. They're maybe too complex, or they're too impersonal, or they're too infrequent. I think there's lots of opportunities in this particular barrier to overcome it. Again, all of these that I'm talking about, these are not new barriers. I think a lot of us have been trying for years to overcome them, but I do think there's lots of opportunities here, and I'm sure we're going to get to that as the panel continues. And then lastly, just to round out, my 4th was limited access to providers and care. And this I would categorize around, some members have difficulty finding a dentist that accepts their plan. Rural communities, as you cited about the high percentage of members living in shortage areas, they just don't have enough dentists, much less specialists. The challenge of taking time off work, finding childcare, right? Finding transportation, that makes accessing care difficult. There's certainly a number of people, especially seniors, who might actually have physical mobility issues preventing them from accessing care in a traditional setting. So here too, I think there's lots of opportunities to kind of bridge that gap. But I'll stop, and certainly my fellow panelists have some thoughts on the subject too, I'm sure.
Yeah.
Maria, coming from the perspective of Colgate-Palmolive, a company that touches clinicians, patients, household brand, what is Colgate's thoughts on how to break down some of these barriers and, increase individuals' awareness of the importance of oral health?
Yeah, Denise, we're in 60% of all homes. So we get the opportunity to interact with many consumers globally. And as Brett, has really highlighted, oral health literacy is very low across the world, including in our country here. And so we actually developed a tool called Know Your Oral Health Quotient, or knowyouroq.com, where we are educating people about the importance of oral health. And we've learned a lot in listening to what consumers are saying. And we've learned that people don't even realize that caries is a disease. Caries, periodontal disease. These are diseases that people face, the most common oral diseases, the most common chronic inflammatory disease in the world is periodontal disease. So educating people that these diseases cause infection and inflammation, and that it's not elective, as Brett said. Treating infection and inflammation is not an option or elective. People need to understand that. So you have to educate them about these diseases and about the connections that they have with their overall health and well-being. And we know that if you have chronic inflammation, infection, it can increase your risk for cardiovascular disease, diabetes, adverse pregnancy outcomes, respiratory diseases. Most people don't know that. And we've learned that as well as we take them through these questionnaires and then give them additional information. We're hearing, never heard this before, didn't know this. I mean, we talk about it in our circles like everyone knows these things, but unfortunately, many people don't. And then also many people are not aware of the signs and symptoms of the disease, and that many of these diseases may not have signs or symptoms until they're so far advanced. So, really understanding about the disease and then recognizing that you need to see a healthcare professional to be screened until we can come up with other options. And we'll talk later about, early diagnostics and screening and other things that can be improved. And then also, these diseases are preventable. So what are the preventive strategies that can be used? And, it's interesting, brushing twice a day with an active and a toothpaste, how much time you should spend brushing, how often you should brush, how to brush correctly, mouthwashes, floss, all of these things. Many people have never really been taught about how to use them and what's the proper way of preventing the disease. So they need to learn that as well. And then, as Brett mentioned, in this country, it's amazing that almost 50% of all people don't see a dentist. So many people, they don't know where to seek care. They're familiar about their local dentist. They're learning about DSOs, they're not familiar with that. And then, cost can be an issue. Some of them aren't aware that dental schools have clinics. I mean, the number one Medicaid provider in most states are in dental schools and FQHCs. Many people are not aware of services available in these various facilities. So educating them on the different places they can seek care, and then, working to determine how they will manage the costs and how they need to, people cannot talk to their employers about getting dental coverage if they don't understand the importance of it, right? So, we often lobby from the top down, but it's really the consumer who can demand that oral care is covered, that they have access to care. So it's important that we educate them for those reasons. And then finally, some people, as a former practicing dentist, especially a periodontist, many people fear going to the dentist. And so they fear it either because of their own personal experience or because of things they've heard. But we've become very, very good at managing discomfort and pain in dental offices. And so there are many ways that we can mitigate pain and discomfort. And certainly the fear should be greater about what will happen if you don't go than if you do go. And so that will only come through education.
That's great. And so great segue, Tom. We've just heard about a number of barriers to people becoming aware of the importance of oral health or accessing care. Wearing your investor hat, what has DIA seen or invested in that can help us overcome some of these barriers?
Yeah, I think these are great points by both panelists. And one point I'd like to make on the negative impacts of neglecting dental care. Yeah, I think it's important to note that there are psychological components to that too. When a person can't eat or smile without self-consciousness, there's a big psychological price to pay. So, for example, when I was in the DSO world, I encountered a patient with missing laterals or front teeth. And she had trimmed white cardboard to fill these gaps. And, we helped her with a full mouth restoration, and she's in tears after this. So I think it's really important to point out that, beyond these physical things, there's a human kind of spiritual component to it too, about, that impact that restoring the mouth can do. Now, as far as ideas on kind of early detection, we have two that I noted that we've invested in through DIA. One would be DentaQuest. And so DentaQuest is a Swiss company, and they have an oral test for a biomarker called AMMP8. And that is an indicator of collagenolisis, or breakdown of the collagen tissue. And so this test works to catch that very early. And that's not to be confused with MMP8. There are other marketed products which pursue that test. This one is very unique. And so what the users have found who have deployed this test in their offices, and there are two large DSOs in US, which are doing this right now, and many more coming, they found that what this does is, number one, it gives kind of this objective indicator of how much collagen destruction or turnover there is in the mouth. And again, this can be before the clinician can actually see periodontal problems. And then the other impact is that the patient then understands, hey, I have this score and I need to do something about it. So it's this inducement to get care, to get the hygiene work, and to stick with it, because then there's a follow-up test. And the two DSOs which are deploying this test are doing it gratis for the patient. It's just this pilot program, but it's a relatively inexpensive test on a per unit basis. Another one that we invested in, which was actually our first fund investment, was Pearl AI. And most people have heard of Pearl, but machine learning model trained on radiographs, 2D images, to basically put pastel boxes around potential problems, pathologies, areas of concern. And then, so this has two impacts. It lets the dentist feel like they have a second opinion, kind of corroboration of their result that they're seeing, or the treatment plan they're rendering for this patient. And then it's flipped around where the patient sees this as well. And so it helps them, again, have an inducement to seek the actual treatment, to take care of these issues and stay in front of them. An ounce of prevention is worth a pound of cure. And so those are two we're very excited about. I would say on the provider side, the access side, one thing I noted as I came out of my DSO operations experience, I got on a board in Oklahoma, which is my home state. But this is essentially a board that oversaw Medicaid in the state. And there's 77 counties in Oklahoma. A vast majority of those counties, in fact, are care deserts. And so dentists, just not there. And so how do you get the provider count to increase? I think these are great discussions. Should there be incentives for dentists to relocate to those underserved areas, tax credits, loan forgiveness, increased enrollment at dental schools, dental therapist concepts? But one company we invested in it's Cloud Dentistry, and it's doing things in very unique ways to help with recruiting and workforce management in dental. And so there's a staffing based on a fractional labor kind of a marketplace, the requisitions for staffing needs, float pools, temp to perm services. Problem with this is it largely works in populous areas. So a lot of these areas you all are talking about are more rural, more remote. And I think that's where solutions like mobile dentistry, teledentistry are going to have to come and play a part. So one that I know, I just met this doctor, Nathan Suter, when I was at a dental meeting. He's fantastic. He's with a group called Enable. I think that's one to watch. But those would be my major areas. And I would say lastly, the idea of how to pay for things, the insurance, Medicaid could obviously help. It could expand. Again, there was room for that in Oklahoma. The total budget, there was only a few percentage points. It was mostly for kids. So could it extend to adults? Yes, it could. Medicare could do more. Broader dental insurance coverage, like you noted. Employers are going to have to do more with that and offering more rich benefits. But the final thing I'll mention is Dental HQ is a customizable dental plan that we invested in. Doug and I did actually pre-DIA, but it's run by a visionary kind of founder, Dr. Brett Wells out of North Carolina. And this is just an alternative to standard kind of dental insurance. It's just another way around it. And then to conclude, I would say, lastly, we're looking for third-party financing options to invest in, just to make the whole package more affordable or more accessible for more patients. So there's a lot of work to do.
That's great, Tom, and thanks for making the plug for Enable Dental, one of CareQuest Innovation Partners portfolio companies providing portable dental solutions to geriatric and disabled populations. So. All right. So for Brett and Maria, I would love to hear, whether you've come across any innovative ways to engage, with consumers and helping them become more aware of the importance of oral health, whether through gamification or kind of digital health portals, other things that you've seen that might be new ways, particularly thinking about different, generations. And how different generations consume data, seek out information about healthcare broadly. Curious what you've come across or seen.
Yeah, I'm happy to comment on, connected healthcare, I think will help change the dynamics somewhat. And COVID has really brought it around with, telemedicine and teledentistry. And so, using imaging for consultations. We've worked with companies like Dental Monitoring, and interesting, in many countries and many places in our country where there isn't access to care, almost everyone has a cell phone, right? So how can you use visuals on cell phones to do screenings, to try and help people to identify issues they may have and where to seek help and educate them on preventive strategies. And so we, in India, we worked with a company called Logi AI. And so, those types of technologies, I think, will make a difference. To your point, Denise, I think sensors and wearables and how we can actually use toothbrushes with smart sensors and AI. We've done some work. Actually, we started with Apple in the Apple Health Kit, and we got insights from patients, from consumers about how they use their brush, how often, how long, whether they're using them correctly. And we could provide personalized coaching, which engages people more. And we had other products which were based on augmented reality. And so we could use tracking and gamification to engage younger individuals to brush. And I saw it with my own eyes. I had a nephew visiting and we gave him the brush, and it was part of a game on his phone. And his mom said she could never get him to brush. And then we couldn't get him to stop brushing. He was, these things are addictive. And we also heard, but it's good to be addicted to doing something good, like brushing your teeth, right? And then the other thing was we heard from certain at-risk populations, like parents with children with autism, where it's very, very difficult to get them to brush. It can cost a great deal of money on your medical insurance to bring in people to try and educate them on how to brush, etc., where they were utilizing this gamification, and they also were very engaged, wanted to brush, so that, this way the healthcare providers could spend time on other things instead of this, where we can use technology to really engage. And actually Mark Wolf and at the Center for Disabilities at Penn, they wrote a paper on this, on how it was so helpful in engaging children with autism. And then, Lura Technologies has sensors. Tom talked about biochemical analysis, whether it's for biochemical markers and the omics for the active MMPs, which I'm very, very familiar with the work of Dentanostics. Not only in office, but they actually were developing almost like an early perio test where you could go into the pharmacy and you could say, do you think you have periodontal disease? And it's like a pregnancy test, and you just take saliva and put it on there, plus or minus, and now you need to go and get screened by a healthcare provider. These things would be very, very helpful in breaking down barriers, point of care testing in the office. All of that is really, really important. But one of the things that we did learn with the connected technologies, especially with adults, sometimes they, okay, they do it for a while and then they kind of move on. They're not that interested. So when it comes to monitoring lifestyle and behavior changes, we've been working on texting and motivating people, asking them when we see they've stopped brushing, did they move on to something else? Are they just not using that monitor? So you need to understand what's happening with people. And once again, the phone is very, very helpful because everybody's got one. So that's important. And then finally, I would say, really thinking about high-risk populations. And we talked about, whether it's because of lifestyle, too much sugar consumption, how can you help to reduce that? And that's true of all chronic disease, whether you're diabetic or you've got, risk for caries. How do we work with people to change, make lifestyle and have healthier behaviors? I think that's really important because, coaching, engagement, this all empowers people for self-care. And a lot of the diseases that we are managing are chronic diseases. So self-care is really, really important. So I think there is a lot happening that will help us to overcome some of these barriers, but there's still a lot of work to do because 50% of all people have these diseases, and we need to really step it up here, right?
Maria, I have to share a story. So I have two sons, and my older son, when he was at that point where we were trying to transition from us brushing his teeth to brush your own teeth, and your dad's in dental, he should listen to me, right? We got the Colgate toothbrush with the app, and that did it. That did the trick. So as you were explaining that, I remembered Eli and his Colgate
I'm
toothbrush.
glad to hear that, Brett.
Yeah.
I wish they had it when my son was going through he had to brush on his own because he didn't. And I was like, I'm a dentist, honey. This is embarrassing for me to take you to the dentist and you haven't done a good job. If he heard me right now, he'd be so upset. He's 20. But, once he found girls, he started being more motivated himself. But it's great if we could do it early because the earlier, the better.
I think it's good personal evidence that gamification works. An app is better than dad telling you to brush. So
yes, or mom.
yeah. The other thing I wanted to touch on, you mentioned at the end about high risk populations, and when we think about innovative ways to really engage patients, we do think about it kind of from two perspectives. One is an innovative approach, and one is an innovative technology, right? And from an approach perspective, we've seen a lot of success, especially in Medicaid programs, through two things. Number one, the involvement of community health workers, and the other is through case management, right? And I think a lot of this has to do with, we also talked about how do different generations access care, how do different cultures access care. A lot of it, when we think about educating members on the importance of oral health care, a lot of it has to do with who the information is coming from, right? If my insurer is texting me, okay, well, a text is better than a postcard, right? But if somebody from my culture, from my community is coaching me through that, right, that resonates a lot more, right? So from approach standpoint, community health workers, case management have proven to be really successful, but in practicality, you can't scale that out to everybody, right? That's not realistic to think that everyone who's going to have access to those types of approaches. So that's, I think, where the technology does come into play. And so there's simple things like you mentioned texting, and obviously we're trying to lean more heavily on texting and engage. I saw some stats recently. It said 85% of even Medicaid adults have a mobile phone, right? So I'm an adult, I have a mobile phone. I saw a stat that on average, an adult looks at their phone 52 times a day, right? I think maybe on a good day, I'm only 52 times a day. But it also says that 80% of people don't answer the phone if it's from an unknown number, right? I'm 100% don't answer that number. But that's what brings me back to, it's one thing to have the right technology to get the message across, but it's also important who that message is coming from. So I just, broadly, appreciating the digital pathways, emails, texts over traditional, I think that's meaningful. But the communication efforts are only going to go so far. They don't bridge the gap when it's hard to get to a dentist because they don't physically exist in my rural community. So I want to, Tom mentioned mobile dentistry, portable dentistry. I was going to mention Enable Dental too. I had a chance to talk to Enable Dental recently, right? Bringing care to where the need is into those senior communities or even residents. I think that's really important. And teledentistry, I think still holds a lot of promise, especially when we talk about those with dental anxiety, right? Maybe that's a good opportunity for the first engagement to talk through, get a consultation, provide them a little education on the importance. So I think it's the approaches, it's the technology, it's the combination of the two. So again, I think lots of opportunity for sure.
No, I love that. And I love what you were saying about the importance of community and kind of getting the information, and the help. But that's going to take work, right? So if each of you had a magic wand and could, kind of do something to solve this problem and help, increase the awareness, what would that be? Anyone can jump in.
Well, I'll go first. I think, as I mentioned, consumer awareness is really important. And it's not just aesthetics. It was interesting. I was on with the WHO. They were saying how they monitor what's happening globally. And the amount of times people are brushing a day or even brushing in a day is decreasing, because many people are looking at oral care from an aesthetic nature. It's about whitening. It's about, everything but, the diseases we're trying to manage. So we do have to educate on infection and inflammation. It's not an option or elective. It needs to be managed. But I also think success will come from breaking down silos between the consumers, the payers, the healthcare providers. Oral care, now we talk about it being part of primary care. It's important to your overall health. Industry, people like us in the health and wellness industry, the researchers, the academics, we all need to work together to make a difference. And we can't do it in silos. So that's really important. I think also, I was presenting at a meeting in Merida, Mexico, and had the opportunity to meet with former governor of Kentucky, Steve Beshear. He said, if you don't give the economic rationale, Maria, nobody's going to do it. You could talk about this data all day long, but the economic rationale is important. So through the Global Health Equity Network within the World Economic Forum, we developed an oral health affinity group because it wasn't really recognized by all the businesses in there who were working on a zero health gaps pledge that oral care needed to be part of it. So we wrote a position paper, a white paper on an economic rationale to invest in oral health globally. And when you look at the numbers, and it comes from a lot of insurance carriers in the US that have both medical and dental, when you go for your oral health treatments and you manage oral disease, you reduce the costs on, managing other diseases like diabetes, cardiovascular disease, preterm births. All of that is reduced. And the savings are tremendous. So it's really important to think about, not only the economic benefits, but Tom mentioned, we did a survey and parents, they said their kids, when they have caries, they don't do well in school. They're missing school days. They get depressed. The parents are upset. They're upset that their kids have caries. And even when you look at missed days of work, for yourself to manage oral disease and pain and discomfort, for your kids to stay home with your kids because they can't go to school because they have pain or discomfort, your ability to move up in your organization, who becomes that person that Tom talked about who was missing 2 laterals. Are you going to be at the front desk? Are you going to be interacting with people? Probably not. Once their teeth were fixed, their potential went up dramatically and their earnings go up dramatically. So, when you think about the economics of it, there's a lot of reasons to invest in oral health. So I think that's really important. I think AI will help us with a lot of things, analyzing the big data that we're all getting and monitoring, analyzing, making recommendations for patients, making recommendations for clinicians. I think, embracing the 4 Ps that Lee Hood said would really drive medicine forward. We need to be more predictive, more preventive, more personalized, and more participatory. People have to participate in their care. We will never succeed if they don't participate in their care, and if they don't mobilize to get into a dental office and get the care that they need. So it's really important.
Yeah,
Love that. And Tom, I was just going to say, I would love to hear, we've just heard about all this amazing opportunity, right? Despite the challenges. So what advice would you give startups that, are looking to, create new, innovations or ways to engage with individuals on their oral health?
Yeah, thank you. So I think one takeaway for innovators would be that there's a growing universe of investors in dental tech. So, while we at DIA don't invest in more than a select group of companies by our mandate, and there are a lot of other groups coming into the sector, and whether they're fully focused on dental or partially focused on dental, there's a growing cadre of investors. I would tell innovators to address a pain point or pain points in dentistry, and do so with a solution that's easy to implement, easy to use for the dental provider and the patients, and which survives economic Darwinism at the office. I mean, this is one we talk a lot about at DIA. It means that they have to solve a necessary problem, and that in doing so, they create this incremental revenue and profit without an undue implementation burden in the process. So these dental providers or end users, they're inundated with options, that all these different solutions which are going to change their lives and the lives of their patients, but only the ones fitting that bill that I just mentioned will survive. And then, as you listen to this session, by all means, if you want to make the dental pain point address part of the broader health journey or overall patient health outcomes or underserved markets and access to care, all those are great considerations, but they do have to translate into that revenue and profitability to make it over the long haul. I would say too that what we're doing at DIA, mostly we're investing in companies which have some kind of traction, meaning revenue. And so they also have regulatory approval in place. And then we're looking for jockeys or teams, the innovators themselves, who want to grow at a rapid pace post-investment. And that's where we can really help them. We help with the market access. We give mentorship to get them there. We're seeing this play out. Our average annualized increase in revenue for a fund portfolio company is 114%. So we're betting on jockeys, I think, and they're solving these kind of very salient pain points. The jockeys and teams themselves, it's a big one. We're looking for people who are persistent, irrevocably passionate about solving a problem, and possessing clarity of purpose and focus. So be those things. And I would just say, reach out to us if we can help you, and I can get more contact information. I'm findable on LinkedIn. I'd love to talk with people who have innovation.
I love that. Well, this was such an amazing conversation. I really appreciate all of your perspectives, but I do want to make sure that we have time to talk more about our Smile Health Accelerator program. So at this point, I'm going to turn it over to Gina from Matter. who is going to dive a little deeper into what the program is all about.
Amazing. Thank you, Denise, and thank you to our panelists today for really helping us dive deeply into understanding our oral health. I can't wait to share some of the Smile Health 2025 program. Thank you. With this, I first would encourage all of the innovators on the line to visit our landing page. So if you go to carequestinnovation.com/smile-health, and we'll go ahead and drop that into the chat, you'll find the landing page for our program. And as was mentioned at the start of today's session, this is actually our 4th year of the program, really empowering innovation that helps the world smile. As we mentioned, it's an accelerator program that really focuses on how we can look at oral health differently. Not only is it a great program, there's a lot of key benefits for participating in it. So one of the first things I'll say is there's a non-dilutive cash stipend up to $15,000 this year from $10,000 in the past for companies that participate, in recognition of the time and energy that they spend really participating in this program. Then there's also sort of the crown jewel of the program, which is the validation study. So as part of the footprint of this program, companies are matched with an industry partner that will help them investigate a key hypothesis around their solution. Companies that participate in them are like Colgate-Palmolive and DentaQuest, and many others. We'll talk about them in a little bit, but really a really unique opportunity to uncover key insights about your solution. We offer also a data opportunity. So CareQuest Startup Data Hub will have some self-service capabilities, and you'll be able to access some curated data. So again, new and very cool features that we're bringing to the program this year. There continues to be mentorship opportunities with folks in industry. We do our best to really connect people with the types of expertise that they need. Custom curriculum, dedicated pitch support. The program culminates in some very exciting public events. And then ongoing access. So you'll get support from Matter via a 6-month membership at the conclusion of the program. And then last but not least, future growth. Companies that participate in Smile Health are really part of our family of alumni and companies. There's a particular program called Accelerate, which I'll share just a little bit more about in a second here, that's open to graduates of the program. You'll see throughout the page that there are these start application budget buttons. We encourage you to apply. They're located throughout the page to help you get going on that. And the next thing I'll say is that there's a few different tracks or areas of interest that we have for this year. So the first is advancing accessible, equitable, and integrated health. This is sort of our kind of overall track here. It's been the year-over-year focus for the program, and certainly we're looking at solutions kind of across these areas. But then we're also looking at 2 other areas. So engaging people in their oral health, really key to the conversation that we had today, asking the question how we can more effectively activate individuals and communities in oral health to enhance oral health outcomes, promote that self-care, and reduce disparities. We're also really interested in connecting chronic care with overall health. So how we can help people at risk of chronic conditions better manage their overall health through oral health. And we heard a little bit about the connectivity to kind of our broader medical space as well. So again, we really encourage you to think how your solution may apply to those. Who should apply? So this is a global call, open to solutions across all disciplines. If you have a solution that's ties potentially to one of these areas, but you've never worked in oral health before, we really do encourage you to come along. We're really excited about kind of that cross sharing of information. But we also want companies that, you know, have a little bit of a demonstrated hypothesis, some preliminary proof of concept on how your solution addresses the focus area. And of course, you have to commit to approximately 10 to 15 hours a week in this very rich and robust program that I outlined a little earlier. You can read a little bit about past participants, such as Dr. Adam Schuloff, who's the CEO and founder of Grin. And I'll just take a quick moment to tell you about kind of some of the key dates for our program. Applications opened in early March. They will close May 4th. So coming up very quickly here, we'll be announcing the cohort June 26th. The program will run from June 30th through October 22nd. And included in that are two really key dates. October 7th and 8th in Chicago at Matter is the Innovation Exchange, which is a really dynamic alumni program, and then Reveal Day, which is a closed door session with partners and companies. Also, October 19th and 22nd, we'll be hosting the Smile Connect program at Health, a very large health conference taking place in Las Vegas. You'll see that we also have a number of our partners here that we've worked with year over year. We're always excited to add new partners. So if you're on this call and you are working in an industry and think that this sounds intriguing, please reach out to us. We're always excited to add you on. And for those of you that are startups, this is just a snapshot of the types of support and community that you'll get access to. Last but not least, I want to show you a new and exciting page. So if you come up here to the Smile Health, you'll see a little bit about Accelerate. I mentioned that earlier. This is a program put on by CareQuest Innovation Partners for graduates of the Smile Health program, really encouraging them to continue to develop their solution by working with industry partner and providing non-dilutive funding to do so in a discrete footprint. Really, they're 6 to 12 month projects, and we have just a number of great examples of how this program has worked and just some of that ongoing support that we put behind the companies that we work with. Certainly, if you have questions dropped into the chat here, you'll see smilehealth@carequestinnovation.com is how you get in touch with us. You can also do so through that website. We're so excited for you all to join us on the Sears journey for Smile 2025.
Thank you,
with that,
Gina. And we're
thanks.
excited for more applicants. You have till May 4th, as Gina mentioned. So check out the website and get your applications in. We'd love to have you part of Smile 2025. And thank you to my amazing panelists. You were great.
Thanks, guys.
Thank you.